Now, the new data from the Health Effects Institute show that 1 in 4 dementia deaths can now be linked to air pollution. Dementia, a group of brain disorders that cause memory loss, confusion and impaired thinking, is being recognized as one of the growing health threats linked to poor air quality. In a State of Global Air 2025 report produced that by Health Effects Institute in collaboration with the NCD Alliance, researchers found that air pollution-related dementia deaths have doubled in the last 2 decades alone. Pallavi Pant, head of global initiatives at the Health Effects Institute, says the finding highlights how the air we breathe is affecting not just our lungs, but our brains. She spoke with Clean Air Beat reporter Michael Ashale.
Yeah. So, if we think about the numbers to start off, what we report is that about 1 out of every 4 dementia deaths worldwide was because of exposure to air pollution in 2023. So that's a pretty big, very sizable contribution from air pollution, about a quarter of all dementia deaths coming from air pollution. We also see that the impacts tend to be higher in many Asian and African countries. Again, very consistent trend that we're seeing for everything else. What is perhaps worth highlighting here is that as our diagnostic tools and our understanding of these diseases improves, there's likely to be a greater focus. We have seen from other reports, not the State of Global Air report, but other works that have focused more on dementia in general, that there is a reason to believe that in future the dementia rates might increase even further, partly because of air pollution, but of course there's other risk factors that significantly contribute to it. And then even in terms of mechanism of, often the question comes up, but how do you know that air pollution is the reason that this is happening? There has been fascinating research done looking at, brain tissue, trying to understand what really happens when you have air pollution exposure. And very consistently, research has shown that when we breathe in pollution, it of course goes into our lungs, but it can also cross into the bloodstream. It can cross the blood-brain barrier, cause inflammation in the brain tissue, which then triggers other pathways, which can result in damage to the brain tissue, eventually leading to development of, dementia and other diseases. So I would say at this stage, we have a lot of good evidence, hard evidence to show this linkage. But one gap that remains, and hopefully people that are reading this report and also listening to this conversation can pick up on some of it, is that we don't have enough data yet from Africa or from Asia or from low and middle income countries in general. So it also remains an active area of research to try and create better linkages or create better evidence that is local, can often be very impactful in trying to influence policy decisions as well.